Dr. Bosco Norohna is with us this morning, and we're talking about ENTs. What does ENT stand for? It stands for ear, nose, and throat. And, well, Dr. Norohna, that's your specialty. Good morning.
That's my specialty. Good morning. Thank you for having me.
Tell me about ear, nose, and throat, and how the specialty actually progresses, and who it is that comes to see you for whatever problems they might have developed. What is ENT work?
ENT is actually, the full form is ear, nose, and throat disease. And now, of course, we've had additional components to it, and we've had what we call head and neck surgery. So ear, nose, and throat surgeons deal with ear disease, nose disease, throat disease, as well as disease of the neck. And when we talk about diseases of the neck, we talk about various glands in the neck, like the thyroid gland, the salivary glands, and the lymph nodes. And this is becoming a widespread situation because we're seeing a lot of pediatric as well as adult ear, nose, and throat disease.
Mm-hmm. Thyroid is one of the things that you just mentioned, and I don't know that it's because we deal with it within our own family or not, but it seems like you hear more and more and more about people with thyroid problems. Is that true?
You are absolutely right on that front. And there are various reasons why we're seeing more thyroid disease. Of course, we're becoming more aware of thyroid disease. But the other issue is the investigations. We're doing a lot more investigations in terms of radiology of the head and neck. Think about a patient who gets a head injury, ends up in the emergency room, gets a CAT scan of the head. But if there's some neck injury, he gets a CAT scan of the neck. And incidentally, they might find a nodule in the thyroid gland. Mm-hmm. Let's look at another scenario. Somebody has a lung cancer or some lung disease, goes and gets a CAT scan of the chest. And when they look through the upper part of the CAT scan, they see the thyroid gland. And then they notice something in the thyroid gland. So these people end up having an evaluation for whatever they've seen in the thyroid gland. Mm-hmm. So we're having a lot of incidental pickups. And when I say incidental, it's an incidental pickup because somebody goes for an investigation, they find something incidentally, and then we investigate that further. So thyroid disease is becoming an issue not because of just incidental pickups, but the number of thyroid nodules that we see has increased. We really don't know why. About 40% of people above the age of 45 have thyroid nodules.
What are some of the ramifications of thyroid disease?
The ramifications are financial ramifications and cost to healthcare industry, as well as early pickup of disease. So we're looking at two different fronts. When we first came across what we call thyroid nodules, which is the most common form of thyroid disease, it's a nodule within a thyroid gland, which is abnormal. Now, these were picked up by various investigations. In the old days, before we were finely tuned as to how to investigate these, there were no guidelines. Everyone ended up having a thyroid surgical procedure where part of his gland or part of her gland was removed, and sometimes the whole gland. Now it's changed a little bit because we have what we call ultrasound evaluations and ultrasound-guided needle biopsies. So we can actually target those nodules with an ultrasound, stick a needle into the nodule, get a few cells taken out, have it evaluated by a pathologist. So that has cut down the number of thyroid surgeries. Mm-hmm. And overall, yes, we are doing a lot of thyroid surgeries because of early pickup of nodules, but the numbers have gone down because we're having more stratified ways of dealing with this.
Dr. Bosco Norohna is with us this morning here on Indiana in the Morning. Thyroid is just one of the many areas in which you have concern. Ear, nose, and throat is another. And those issues in Indiana County or in this region, again, are things that we hear about quite often. I don't know, you probably do. Are ear, nose, and throat difficulties more problematic in this area than anywhere else? And what are some of those issues?
Ear, nose, and throat disease has been prevalent in all societies. When we look at it in terms of numbers, nearly 20% of children visiting his or her pediatric doctors have ear, nose, and throat problems. In the adult age group, it's about 15%. Now, in this area, Western PA, it's the allergy capital. of the Northeast. So we're seeing a lot of sinonasal disease. When I say sinonasal, I mean allergies, sinus infections in adults and children. But in children, we do see a lot of enlargement of tonsils and adenoids. Contrary to what people believe, we take out more tonsils and adenoids, or we subject more children to surgery, not because of recurrent tonsil infections, but because of very large adenoids and tonsils. And these children have bad breathing problems at night. They snore like adults, and it's more like an adult sleep apnea. So that is a ramification of ongoing sinonasal allergies indirectly affecting adenoids and tonsils.
I was interested in that because I have a nephew who just had adenoid surgery, and they noticed immediately the change when the surgery occurred, because all of a sudden the breathing was better, the sleeping was better. A very young boy, and the kids often they have no idea that they have a problem until the problem gets fixed, and sometimes that's a big adjustment for them.
Yes, it is, and most of these children present with very severe snoring, and parents will say, we can hear that child snoring across a closed door. And, some of them will say, well, this little boy snores louder than my husband. But, that's only part of the problem. Big adenoids and recurrent sinus issues have been correlated very well, because many of these children have bad adenoid infections contributing to sinus infections. And, when the parents come to the office, they say, my boy just breathes through his mouth. He's never, ever been breathing through his nose. And once we deal with the adenoids, we're dealing with two issues. We're improving the breathing as well as dealing with recurrent sinus infections.
We are working our way up from the neck all the way up to the top of the head. I want to go to the ears now, because in the summertime that becomes a problem for folks for a variety of reasons. One of those is the exposure to noise, and I know that has to concern everybody as they age, but I think if you catch it early enough and you start protecting your ears earlier in life, that's certainly going to help you.
Yeah. Noise-induced deafness is a big problem, but I think, to a certain extent, with the general education in the public and OSHA regulations, I think people in these industrial setups are better protected as compared to people in the past. I mean, I see a lot of veterans who were exposed to heavy artillery fire and gunfire.
Sure.
And, they didn't have protection in those days because nobody really thought about protection. Now it's become a major concern, and it's something that's been followed in all forms of industrial setups. So noise-induced deafness is certainly something that we're seeing less of today.
What are some of the ear issues that people do have with audiology concerns?
Most of the ear issues that we see are in children. As you may have heard from my earlier mention of big adenoids. We forget about the fact that in children less than 3 years of age, even though they may have moderate-sized adenoids, they may not have a lot of snoring. But the adenoid is a reservoir for infections. The adenoids get infected when the child has a cold or a sinus infection, and from there it travels into the ear. Now there's a tube called the eustachian tube that allows air to go back and forth. It's like an exhaust pipe for the ear. It's very narrow in children, so it gets blocked very easily. So they accumulate fluid behind the eardrums, they get infected. So we see a lot of ear infections. And when I say infection, these are middle ear infections. They respond very well to antibiotics because we have high-quality antibiotics today as opposed to even 15 years ago. But about 5% of these children end up having multiple antibiotics. And once they have 3 infections in 6 months or 5 or more infections in 12 months, that's when we recommend putting in tubes to facilitate drainage of the fluid behind the eardrum.
Would multiple ear infections impact their hearing to the point that at that young age their speech development would be affected?
Absolutely. You got that right. Many of these children, they do get ear infections, they get treated, they do very well. But the fluid doesn't disappear. And when that happens, they have a hearing loss, and that can impact on the speech. And that's a very difficult situation. Fortunately, it doesn't happen too often because when a child has an ear infection, they get treated. If the fluid doesn't disappear, it's easily visible, and they come back, see us as an ENT, and we deal with it. But there are a few occasions where the fluid is transparent. And whenever the primary care physician or the pediatrician or even an ENT looks in there, it looks like a normal eardrum. But the only reason why you decide to evaluate that child is because the speech isn't coming on very well. And that can be a problem at times.
Yeah. Dr. Bosco Norohna with us here this morning on Indiana in the Morning. Being an ENT, I would assume that most of your patients come to you by referral. A primary care physician is that first line that people notice that there is a problem, they get sent and referred to you. Is that the way that it generally works?
It generally works that way. I mean, works in multiple ways, but referrals from primary care physicians, pediatricians, and from the emergency room account for a large number of our patients. But then we get a large number of patients who come in by word of mouth, because we have patients who we've treated previously, and they will pass on the message to family, friends, relatives, and that's how we get a lot of referrals, especially a lot of my thyroid patients. They come into me because they've been referred by friends or family or people they know who've had thyroid surgery in this area.
One of the things that we have not spoken about is we've done the ear, we've done the nose, or we haven't done the nose. I want to get to the nose, the nasal cavity. There are always issues for folks who have breathing difficulties. They're breathing through the mouth more because their nose is obstructed. What are some of the things you deal with there?
We see a lot of nasal problems here. As I mentioned earlier, this is allergy capital. So we see a lot of allergies related to the nose, what we call allergic rhinitis. Allergies are generally treated medically. They do very well with medical treatment. It's only when they have bad allergies not responding to medical treatment would we take the next step as what people call allergy shots. Now, allergy shots is basically a technique where you're using a vaccination technique. You're actually extracting some of the proteins from whatever the patient is allergic to, and then you're diluting it and injecting it into the patient. So what you're trying to do is help the patient build an immunity to whatever he or she is allergic to. And we see a large number of patients with allergy. Fortunately, more than 95% respond to medical treatment. 5% need skin testing. They end up having allergy shots.
Yeah. We have not talked about specific injuries suffered, and that is also something I know that concerns you. And I would guess that a lot of those injuries are the broken nose from playing ball type of things, and those are things you have to deal with as well.
Yeah, we do see a lot of sports injuries. Most of these are young athletes, high school athletes. Some of them are IUP, college athletes. And for them, it's a problem. We see that category. We see the older category because of the ongoing new trend of fitness. And there are lots of people in their 40s and early 50s who were never athletes when they were young.
Yeah.
But because of this new fitness boom, they've started running, they're doing marathons, doing triathlons, and they come to me saying, Dr. Norohna, I can't breathe. And I asked them, I said, you're 50 years old. Well, I was a couch potato. I just worked at a desk. Now I'm running because I need to lose weight. And that's another group we see. So nasal obstruction is a problem. It's mainly the inside of the nose that's bent or broken, and these people can't breathe. Surgery is a curative form of treatment. It works very well. It's a little rough in the immediate post-operative period, but the improvement of breathing is remarkable, especially if you offer it to a patient who has significant nasal obstruction.
Yeah. And I would guess the longer they've been suffering from it, the more they notice the difference when it is repaired. He's Dr. Bosco Norohna. We're out of time. Thank you so much for coming in to visit with us here today. Folks want to know more. What do they need to do?
They can contact my office. The number is 724-349-5440.
Thanks so much for coming in.
Thanks for having me.